Person may make that final devastating choice. They and their families may spend years trying to get them treatment in their worst moments of crisis. Go to a hospital. Sounds simple enough, but those settings aren't always crafted to best take care of children. Assemblyman James Ramos thinks families have waited too long for a lifeline in California, and that's why he's pushing AB 2317. Welcome back to Fox 40 News at 11.
Thank you. Thank you for inviting me back.
Hard to believe, but there are fewer than 100 residential beds for kids experiencing a psychiatric crisis statewide. Most counties don't have any. How can that be, and how can AB 2317 fix it?
So 58 counties in the state of California, 48 counties have no services for our youth. This bill starts to address that with AB 2317 for the psychiatric residential treatment facility, and narrows a gap of definition between the federal and the state to ensure that resources are available to ensure that mental health is something, when people are calling out for their resources, that counties are equipped to respond.
This bill is about creating and regulating crisis residential treatment for children and youth. What exactly does that look like? What does it mean? And how long could a placement last for a child and their families under this bill?
So this bill, AB 2317, clarifies that the room and board is an allowable mental health cost, which allows federal reimbursement for this cost, not just state or county funds. The gap has resulted in no children's crisis residential program. 2317 starts to close that gap, because what we've seen so many times in my prior office on the County Board of Supervisors, San Bernardino County, now in the State Assembly, we've seen this issue come up over and over again. But we have to make sure that when our youth are calling out for resources in time of need, that their only alternative is not the emergency room or juvenile hall. We need to make sure that we have a psychiatric residential treatment facility to tend to their needs, to ensure they have long-term stability to help them through life.
Between 2016 and 2020, the Annie E. Casey Foundation reports that California kids 3 to 17 experienced the second largest increase in cases of anxiety and depression in the entire country. That's a recent interval. They may be intensifying, but these kinds of problems are not new. So how is it that this kind of critical care for kids hasn't happened before now?
Well, that's a good question. When I first got into the state legislature, we started tackling mental health issues. We created with AB 2112 the Office of Suicide Prevention, and we're continuing to bring resources to this much needed area of mental health. Sometimes when we talk about the economy, we talk about inflation, we need to start putting into the fold of those discussions the mental health and mental well-being of all those in the state of California, and that includes our youth, that we see data and the skyrocketing of those areas moving forward where they much need these resources.
Why is it so important that this system we create in California through legislation align with federal Medicaid provisions? How does that help stand this whole thing up?
Because it's the reimbursement of the those policies that are there. The definition that we're talking about, currently the Department of Health Care separates room and board costs from mental health services, which results in no federal share or reimbursement. So we're bringing that to light, and we're fixing it along with the support of the administration to make sure those resources are there for the counties to be able to implement these policies and this infrastructure. But we have to also bring into account, when we talk about the budget of the state of California, that we need to talk about the mental health and well-being of all in the state, and that includes all in the state of California, especially our youth, where we see the spike going higher and higher.
I know you've been talking to so many families as you've been working on this piece of legislation. The desperation out there must just be intense. You know you need help, your child needs help, your family needs help, and there's no right place to turn.
It is, and we've heard it over and over that parents are calling out to get resources for their child, but yet they fall on deaf ears sometimes. Looking at 58 counties and only 48 counties have no services in this capacity. We have to do better as a state for our young people and for our parents that are struggling with their siblings.
The state Senate just had its third reading on AB 2317. It's gone to the Senate floor. What happens next with it?
So we have Senator Portantino, who agreed to jockey this for me on the Senate floor. He will present that, and it'll come back to the Assembly for concurrence and then to the governor for signature. So we would encourage those that are in support of this bill, 2317, that if you could start to write letters in support that it's time that we bring resources to our most vulnerable, and that's our youth in the state of California.
All righty, thank you so much, Assembly Member. We'll be tracking the progress. We appreciate you.
Thank you.